So thank you very much, sir, and thank you to Tushar, sir. I do agree with some of your points. So, but as the topic reads, no course required, and in which cases you should not go for an MBA is more important than in cases that you should go for an MBA. So, just to describe, to water down the course, not to reduce its ability to educate people, it's more of a theoretical and a practical training in business and in investment management. That is the primary goal of an MBA. But over here, the backbone of contention is an MBA absolutely redundant for a healthcare professional, or is it partially redundant, or can we even consider it going forward? Because we only hear the success stories. We do not hear the vast majority of people who also have that MBA degree with their MBBS or MS degree. So what we learn is application is more important than information, and business management is one part of it, but learning to apply it is a life skill. So does anyone remember all their life skills from their childhood? Remember getting your first bike and not having to read a manual or attend a course and just learning it on the fly? Remember falling into the pool and your younger or elder sister or brother pushing you and teaching you that life skill? Yes, that's how you learned it. I mean, today's kids or my children in the future might watch a YouTube video or attend a course on it, but ultimately they will have to jump in the pool to learn it. So there are pros and cons. I'm not here to deter anyone from doing an MBA. It's just to open your mindset about when or why you should do an MBA. It does give you global exposure. It does increase your brand value. It does give you an entrepreneurial support. And definitely it is very important for networking. Stuck in MBBS, stuck in MD or MS, stuck in DNB, we have lost contact with the outside world. This MBA does take us to the outside world. But let's look at one more small example. Today's laparoscopic surgeon, did he learn laparoscopy during his residency? Did he learn any of these ports and maneuvers? No, he did not. He learned it on the fly. He did learn the basics, and the basics are available everywhere. He learned open cholecystectomy during his residency, but today he's teaching it in a course, but he never learned that in a course. So a few days ago, a resident of mine was telling me that he or she wants to learn gonioscopy. So not to deter anyone from SSTC and TSTC, but he or she wants to learn gonioscopy in SSTC or TSTC. So you can do a course on it, but as anyone who's held a gonioscope and is a glaucoma practitioner will tell you, if you do 100 gonioscopies, you're well off, and if you do 1,000 gonioscopies, you're even well off. No amount of diagrams will help you over there. So once again, coming to the fact that I'm trying to reiterate that applying this is a life skill. So the entire gamut of being a doctor as well as managing a business administration includes man management, people management, growth targeting, growth assessment, most importantly liability assessment, and finally taking all that into account, revenue generation. So coming back to the cons of an MBA, so I was sitting with my MBA friend who's earning 3 times the amount I am earning today, and he was telling me that to do an MBA, you need to have around 28 to 30 lakhs in your pocket. That's for the top B tier schools in India, and there are about 400 to 500 seats for the same. So I don't want to deter anyone from a bottleneck, but imagine you must assess whether you're ready to invest that amount and what are the returns you get from that amount, full well knowing that it is not a technical skill. It is not like MIGS. You attend a couple of courses, you do your first MIGS, your first eye stent falls onto the iris and you pick it up and someone tells you this is what you do. You have to cater it and tailor it to every individual, to the company that's coming and trying to break a deal with you, to the staff who's trying to be naughty or not trying to listen to what you're trying to say. So it will not teach you anything in practice management, but you will learn it on the fly. Once again, it's not a golden ticket for everyone. Know your strengths, know your weaknesses. An MBA is good, but knowing when you do not require a course is even better. Thank you.
Thank you, Dr. Anujeet. That was very interesting. We'll come back to Dr. Tusharya. I'll ask Dr. Ashish to give his pointers, then we'll have more discussions on this.
So yes, see, I feel There are about 6,000 plus individual eye care practitioners across India who have their own clinics. And when we are opening our own hospital, it's like a startup where we have to manage and do everything ground up, to managing of staff, to accounts, marketing, improving on our skills. And there are a lot of things, which we have to learn, managing finances, which we are not taught in our, postgraduate days or even schools. So, but again, finding out time for a structured course is quite difficult, I feel. It's good that, you have managed and you have done it. And even AIOS at its level has a program called Leadership Development Program, where they teach a lot of administrative skills and leadership skills to, individual ophthalmologists. And I feel that, see, we have access to a lot of books which we can read, and if we read about 1 hour per day of books on different aspects, we could be in the top 10% of our field very soon. So I would recommend one book called The Personal MBA by Josh Kaufman. That's a very good book on learning the basics of MBA. There's another book on art of negotiation, that's by an FBI agent. There is another good book on financial planning for life. So if you see an average CEO of a corporate, they read between 30 to 50 books per year. So if we have that habit of, reading books which are easily available, we can get a lot of information, and then we can modify it and apply it in our field.
I'd just like to clarify
Yeah, please,
one point.
please.
So, I think I completely agree with you about doing a generic MBA where, you go do a resident program for 2 years. It's not practical for us, and I don't recommend that either. Just that there are a lot of working MBAs for working professionals, and there are specialized MBAs which are directed towards healthcare. And I also don't recommend doing a long 2-year MBA either. I'd recommend doing like a general management course, which is maybe a year long, where you have to spend some time in the business school, but the rest can be done online. So there are a lot of modifications available. So, just like how we do Cornea Fellowship, Retina Fellowship.
Exactly.
So we don't have to do a comprehensive business fellowship. We have to do some things which are relevant to us, find a relevant program, find something where we can devote the kind of time that we have available and do that. Definitely, I don't recommend doing a 2-year resident MBA either.
A couple of things, Dr. Tushar. Can you tell us what course did you do and how did you go about, and what would be the ideal time to actually do these courses?
Yeah.
Because once you start getting into your practice, it becomes very difficult to even find holidays, let alone doing a course like that. So what drives you to actually do that?
Yeah.
And when do you actually should do, like as we do your fellowships as
Yeah.
early as possible?
True. So what I did was a general management course from IIM Bangalore. This was essentially a 15-month course, out of which 40 days I had to be in IIM. And the rest was online, and you get a lot of study material through their application, etc., on their mails, and you have to read up all of that and go to the. So it's a great exposure to have, and it was not. It's not about a general management course. It's about understanding the global scenario in terms of healthcare. It's not going internal, looking at inventory, etc. So I do believe that it gave me a lot of knowledge, in how the world works, in how finances works, or how businesses work, and I think that has really helped me. The right time to do it is as soon as possible. I did it right after my fellowship finished. I was in practice, just starting out practice, and I thought that was the best time, because once you get busy with practice, it's very difficult.
Yeah, one more question. What was the toughest decision you took as a CEO rather than the CMD? Maybe, not a medical director, but the in charge of your place.
I think the
And
toughest.
How was it different?
I think the toughest, I won't say it's one decision, but the toughest thing I find is managing people. And again, I spent most of my life, grown up life at least in South India. And the transition to Delhi itself was a huge change for me. The staff there, the patients there, to set systems that work in terms of HR, in terms of leave, in terms of timings, it is very, very difficult. And I think setting up that structure and that systems is the biggest challenge, which I still have to deal with.
Absolutely. Like, there is no course for man management.
But you know how, what is the right way to do it, and then you can modify
absolutely.
it. So you have a baseline.
Absolutely. Like, not all cataract surgeons have done an IOL fellowship, but those who have, some people have learned anterior vitrectomy along with other techniques outside. So it does work. It does work.
True.
Can you elaborate any smaller courses where people can actually take in, and
Yeah.
not what Dr. Anujeet was talking about, 30 lakhs or
Yeah.
if
Yeah.
there are free courses, because a lot of newer courses on AI management
Yeah.
and depending upon imaging, like this is what is happening with us, where they are giving online courses, and it does help you with your CV as well.
Yeah.
And but then again, if you can recommend a couple.
So, in terms of online learning, there are multiple websites now. For example, for hospital administration, there are things on MedVarsity. Udemy has a lot of courses if you're interested in artificial intelligence or just understanding financial statements. Coursera has courses. There are a lot of these websites that are available. I wouldn't say they're free, but they're quite reasonable. And that's something you can do. It's not going to help you get a job or something if you want to transition from a clinical to a non-clinical role, but to apply it into the non-clinical areas of your work, it is quite useful.
We have someone from the audience, if you can come in and talk.
Hello. I am Dr. Mahesh Somani. I have done 34 years of practice now in Indore. And at 2001, I made a group practice of 7 ophthalmologists together working. But I have done my MBA as a regular student, selected by CET from DAV Indore at the age of 55. And cleared with 8.24 as a regular student because classrooms were in the afternoons. I have done complete
Excellent.
work with.
Excellent.
And applying it, I modified one more line with me. Now I'm going NMH consulting also. So in life, learning is never ends. You can do when you want. Doing MBA is always good, and regular courses cost less also. It is not necessary to go for 30 lakhs. I paid only, I think, 2.5 lakhs for the classrooms. Okay. So, but overall, one thing is there for middle management. It is the communication skill. This is important. What is said is never important. How it is said is always important. So that makes learning. And a good administrator is who can listen the things very nicely, not to answer and react immediately for any man to manage. So that's my personal experience. Okay, thank you.
Thank you, sir.
Thank you so much, sir. And I would want to close this topic.